showing you all these hands and feet? That's because today we're going to be talking about girth measurements of the lower extremity and upper extremity. We will begin by saying that all of these measurements that will be taken throughout this video should all be taken twice and on both extremities. Now, as for our first measurement that we'll be looking at is the figure 8 measurement of the ankle. So you should have your position in long sit with their foot hanging off the end of the plinth. You begin by placing the measuring tape midway between the tendon of the tibialis anterior and lateral malleolus. The tape should be pulled medially toward the distal side of the tuberosity of the navicular. The tape then now can be drawn across the instep, ending proximal to the base of the fifth metatarsal. The tape is pulled across the tibialis anterior tendon and continues around the ankle joint just distal to the medial malleolus. From the medial malleolus, the tape can be drawn across the Achilles tendon, circling around the ankle just distal to the lateral malleolus, which is where you can be taking the measurement and recording it. As you can see, we are doing a figure 8 of the ankle. We always begin by cleaning the measuring tape to ensure that we reduce infection. We will begin by finding the tibialis anterior and then go just between that and the lateral malleolus. After that, we will go distal to the navicula, proximal to the fifth metatarsal, distal to the medial malleolus, and distal to the lateral malleolus, meeting back up at the measuring tape where we take and record our measurement for future documentation. When doing these measurements, always double check your landmarks to ensure that you have a correct measurement. The next measurement we will be looking at is a figure 8 measurement for the hand. For this, you should have your patient positioned in a chair next to the plinth with their arm resting on the plinth and their hand hanging off the edge. As for the procedure, you should begin at the ulnar styloid process, then wrap the measuring tape towards the radial styloid process up towards the fifth metacarpophalangeal joint, and then across to the second metacarpophalangeal joint, and then back around the dorsum towards the ulnar styloid process. Now we'll be taking the figure 8 measurement of the hand. We'll start by cleaning the measuring tape, putting our patient in this position, beginning at the ulnar styloid to the radial styloid process, to the fifth metacarpophalangeal joint, to the second metacarpophalangeal joint, checking our landmarks to ensure accuracy. The next circumferential measurement we will be doing typically involves measurements of the lower and upper extremity. It can be used to measure joint effusion, edema, muscle hypertrophy, and muscle atrophy. The measurements should be taken above or below a bony landmark so that it can be reliably reproduced. As for the procedure, you designate the bony landmark and then use 7 points of measurement, allowing 3 points on either side of the desired area of measurement. Then you should measure around each of the 7 points on the extremity and record the measurement. This measurement was sped up to ensure that you can see the entire process. So we begin by finding the radial styloid process, and then we measured out 24 centimeters, and then went at 4 centimeter increments, ensuring that there were 7 marks. Then we measure around the extremity at each mark. For this, we want to make sure that we reduce shearing by having them lift the arm up when it is tight on the measuring tape. And during this measurement, you want to measure twice at each mark. However, it is not shown. We would also measure each arm so that you can ensure accuracy and have a comparison. As you can see here, we are looking at documentation. The appropriate descriptors were added with the documentation, which allowed to appropriately reconstruct the measurement and see what the results were at that time.